We should be recording now. Yes.
Okay, fantastic. Hey, good morning, everybody. I hope you're all doing well and that you're safe and healthy. So today we have a real treat despite our circumstances. We have gotten Dr. Chanel Changfoot to give us a small talk about her road to becoming a surgical consultant and everything that goes apart with that. So without further ado, please welcome Dr. Chanel.
Hi, thanks everybody for following the link. I hope you're all staying safe. Just so you know, I'm taking the meeting seriously. I am wearing pants, but I have decided to wear my flamingo slippers for this meeting because, like Shade said, there's a lot of negativity out there. So we're just going to keep it quite fun and lighthearted. And we're hoping to do more educational stuff going forward, but this is just a test run. I think for any communication regarding further educational stuff, they must just contact the Student Surgical Society. Is that all right, Shade? You are unfortunately.
Yes, that's perfect. So all of the advertisement goes out on our Instagram page. You can find whatever is needed on there.
Okay, excellent. So yeah, we're going to try and figure out educational stuff going forward, seeing the lockdown has now been extended, but we're seeing good effects with that. So we're all in a very good mood. Okay, so like Shade mentioned, this is just a little bit of insight into how I got into the surgical field and why I love it so much. All right, so we'll keep it lighthearted, and if Shade has any interesting questions, she's going to be your spokesperson for this. So for those of you who haven't worked with me or who don't know me, I do have a little bit of an unconventional style, so if you're sensitive, now is probably the time to log off. Okie dokes. Let me show the images. Okay, there we go. All right. Okay, so consider yourself warned. All right, so how I got into general surgery. So the official stuff, you do your MD-CHB, internship, ComServe. You should do a little bit of MO time because that's where you really get your feel for cutting. You do a couple of courses and you apply for your post and hopefully you get in. That could take a bit of time. Okay, so now you get into general surgery. It's a 4 to 5 year course, depending on which university you attend. You have to unfortunately do a thesis, and although it seems a lot of you are into research, I am definitely not. You get a lot of tutorials while you're a registrar, but you also have to give them, as you guys are aware. You do a lot of calls, and you need to realize that the further you get into your career, the less considerate people are of your personal life and of your health. So a lot of the hours you do will not actually be counted or be paid for. So know that going in. You have to do a lot of presentations. You need to keep a logbook of all of the procedures that you've done, and you do various rotations. Okay, that's a lot of the official stuff. Now I'm going to take you on a photo journey. All right, so these are all of the rotations I've done. You guys know most of them and have experienced them at Tygerberg. So now this is from the registrar side. All right. Okay, so just a little bit of history. This is California Hospital in Pretoria. This is where I was an SI. No, it's hard to believe, but we all did start there. We weren't just born full registrars from the uterus. So these are the corridors that I worked in when I was a student. This is my SI group. This is us getting a cut on X-ray. This is the very first baby I delivered. This was in 2000 and let me just move. 2007. It was on Women's Day. The very first baby I caught from start to finish. Okay, you see how young and excited I look. This is my SI group. This was one of the very first crush patients I saw in California Hospital in Pretoria. So it's obviously a national problem. All right, this was my student intern badge. I still have it. This is actually a bit embarrassing. This is my student car boot. This is the first call I ever did. It looks like I'm going camping for 3 months, but I like to be prepared, and I had no idea what I was going in for. So this is what I packed for one night of being on call, and also enough food for 3 Somalian families. This is me in theatre. I'm actually sitting in one of those bowl rolling trolleys. I thought it was hilarious at the time. So I loved theatre from my student intern days already. This is my colleagues I probably shouldn't be embarrassing them like this, but we all get tired. We all have a rough time getting through medical school, so really don't feel bad about it. And I think the lesson we can take from this is also sleep whenever you can. If only we could bank it going forward. Eh? All right. Yeah. One of the very first wounds I ever sutured, and then I realized I love to stitch stuff. I love to do things with my hands. All right. Yeah, my student intern colleagues, and this was my SI group on one of our very last days at our peripheral hospital. That's us drinking on premises, don't tell them. But this was us celebrating our last SI days before we actually wrote exams and finished. I just want to see, we have a couple of anaesthetists, but not so many surgeons in that group. Okay, this was Tie Day Friday that we did. This was our last day at our academic hospital. So we have a peripheral hospital, Kalafong, and this was our last day at the Eco Academic before we wrote exams. This is my internship denier, my student internship denier. So finished medical school, so excited, I'm going to go be a real doctor. You'll notice there's no gray hair, skin is glowing, no eye bag, you know, just so enthusiastic to get started. All right, qualified, and this is where I did my internship in ComServe. This is Kimberley Hospital Complex. I think it's still quite a popular choice with the Stellenbosch students. It has a very nice balance of being on your own and being allowed to do things, which is very important when you are an intern, but also having just enough supervision so that you don't kind of muck through on your own and that you are taught the right things going forward. Because when you get to internship, it really feels like you knew nothing in medical school. Like all of that information is useless. You have to start from scratch. So again, just be reassured. We all feel like that. Even the smart kids sitting in the front row of the classes, we all feel completely out of our depth when we get to internship. Okay.
Can I jump in here and just ask you a question?
Yes, sure.
Dr. Chanel, what's your opinion on, for instance, doing your internship and your ComServe at the same hospital? Would you say it's better to get experience at different places, more rural, more tertiary? Just what's your thoughts on that?
I think that's a very good question. And it depends on if you have an idea of where your career is going forward, or if you are one of those people who loves everything or hates everything. Then I think a bit of variety is a good idea. But if you have an idea of what you like, then it is probably best to stay at the hospital where you have already begun to establish yourself. And if your hospital does offer ComServe time in the speciality you like, it just looks very good on your CV and allows you to spend more time in departments that you like. If you go more rural, you will most probably end up doing more EC work. And that is also nice because you get experience in peds, in ortho, in surgery, in medicine. So that allows you to sample a bit of everything and see is there a direction that calls to you or if you are just a generalist. So it really depends on where you see your career going. Okay.
Thanks so much.
Cool. So this is the Kimberley Griqua. Yeah, there's not much to do in Kimberley aside from work. So you join the rugby club even though you have no idea who's playing, and you socialize with the locals. You entertain yourself with suturing things. This was actually, he's now doing cardiothoracic. This was my junior colleague's first appendix. So I think it's very important in your career to document these little moments, because sometimes you wake up a couple of years later and you know you've come so far, but you don't have any documentation of that. And I think it's important to document the good things, because the type of personalities that we are, I see in my colleagues, you beat yourself up about the mistakes you've made, and that tends to stay in your memory, but you don't remember all the good and positive things that have happened in your career. So take photos, document it. It's important to look back on one day. I did outreach clinics in the surrounding neighborhood. So it's, even if you're not super crazy about the rotation you're in. I was doing pediatrics, and I'm not a pediatrician. Doing it in a new environment and in a community that appreciates it so much does kind of help you put more into your job. I did flight outreach, so they set us in a fixed wing airplane, fetching a patient with, I think he had lymphedema. So that also made it more interesting. Here's our plane. Here I was in pediatrics. We had a fundraising event for some wheelchair thing, I can't really remember, but every department, or you could enter a team and you had to participate in like a wheelchair like a obstacle course, and it's flippin' difficult. Hey, it's not just chilling in a chair, it's flippin' difficult. So I was in pediatrics, and we were the KMCers, the kangaroo mother cheerers. I came up with that. I thought it. So we were KMCers, kangaroo mother cheerers. I still think it's hilarious. Okay, so yeah, this was the surgical department that I worked in. You may recognize a couple of people. If you see there on your left, the guy that looks as if he should be on a skateboard, that is Dr. Estian Lowe. Had a bit more hair there, but his attitude was exactly the same. You'll see in the back row is Dr. Sashla Naidu. He's a cardiothoracics registrar now. And yeah, there's a couple of other surgeons or registrars that are at other hospitals. So very good surgical department. This was for a breast cancer fundraiser that I ran. So I made everybody buy the t-shirt, and they all had to wear it. The guys were actually surprisingly keen on it, I must say. Yes, then I thought, okay, no, I've had enough of relaxing and enjoying my life now. I now need to grow up. And I applied to one of the foremost, although not that popular, surgical programs in the country. And the reason that the Stellenbosch surgery program isn't that popular is because there is a rumor that they work very, very hard. Now, I'm not from the Cape. I unfortunately didn't study at Stellenbosch, so I wasn't aware of this. I just heard, oh no, great department. So I applied and I got in 2015. Very excited. So this is where things started getting really fun. During your abdominal rotations, you get to see all kinds of very interesting pathology. On your left, I think that is a Nokia. Those things are very hardy. And yeah, left of the screen, patient, yeah, doctor left, patient right. And on your right, that is a can of deodorant, which the patient accidentally sat on. It also accidentally had a condom on. But
okay.
Yeah, so all sorts of interesting pathology that you get to see. Burns, also we have the burns unit of our province, so everything comes to us. You will have rotated through there in your third year, but very good experience. My pediatrics rotation, this was a gastroschisis. I built a little silo. They don't really teach you how, you just figure it out as you go. I'm also post-callers all hell in that picture, just in my own defense. Pediatric surgery, not my favorite rotation, but you do meet a couple of very nice patients, and they do tug on your heartstrings, even if you deny having a heart. And then trauma. Now, everybody who's ever spoken to me knows that trauma is my first and only love. I don't care how chaotic it gets or how horrible the patients are. I really love trauma. I really love the pathology, and I'm hoping to get a fellowship post in trauma at Tygerberg soon. So trauma unit, everybody knows when it looks like this. And I mean, it's really beautiful. There's blood, there's poo, there's vomit. It's really all of the rainbow colors in one. This is the group I wrote my intermediates with. You'll see there's a urologist, pediatric surgeon, couple of the general guys, Dr. Boertis, Dr. Budge, an orthopod. Yeah, so you really bond with the group that you are rotating with, very much a camaraderie in the trenches. These are gallstones from one of the very first gallbladders I took out. This colleague did his first laparotomy, so just again important to document. This was at Paul. Dr. Diale, who was one of my work husbands in Tuesday firm. Behind the scenes, you know, even when we're not with the students, you look after your buddy. When they have family stuff going on or they're just taking strain, you look after each other, and you think that an SI partnership is serious. It's really a different bond going forward. Bariatrics that I did, interesting, not the field for me, although I do love to watch my 600-pound life and judge them. But an interesting field nonetheless. Vascular, pictures are one thing, the smells are just something you need to experience, but also one of the more intense rotations at Tygerberg as a registrar, and of course lots of chopping. First amputations. What was it? It was KNM. It's now breast and endocrine. I think this is one of the scarier rotations for the students because it's one of the first clinical rotations where there's quite a high expectation of the students. And I think there are very interesting personalities in that department. So again, it is important to really bond with your registrar, because believe me, they are having just as tough a time as what you are surviving that rotation. So it's a tough one for the students and the registrar, but if you look after each other, you can both survive it. Flamingo list, also very nice to get involved in. This is my surgical department, so you'll recognize all of us there. There's a very strong bond, again, that, you know, there's something about suffering together that just bonds you totally different from having a good time together. So we are actually a very close department. Okay, so I do need to mention some of the negative things. I think it's only fair, but we'll scoot over it and then get you some fun pictures there. So I watched Grey's Anatomy before I started varsity, and I thought this is just the most amazing thing ever. It is unfortunately not like Grey's Anatomy. First of all, there's never enough scrubs for everybody. The scrubs look like shit on you, and none of our consultants are very attractive. So yes, but also the work in the hospital is obviously not this idealistic version. We do have to deal with a lot of political issues. This was protests at my training hospital as a student, but there are always political issues that come to the fore in terms of funding, in terms of stock, and it is just unfortunately working in South Africa, a reality that we have to deal with. Also systems that don't always function ideally, you know, lab systems being down, wards not being stocked, and I think students sometimes feeling like they are being abused by the system. You are not the first student to feel that way, and it's going to get a lot worse. So believe me, when you guys are interns, you're going to be looking at these super lazy students and thinking about what you did in your day when you were a student. So unfortunately, there is also, it does feel like a gradual decline from year to year. Equipment not working, that's Dr. Lambrak's trying to get the lab scopes back to work. Reality. Clinics that look like this, that are going to very soon be your problem when you guys are the doctors. And then at the end of the day, you're just going to be working really hard. And you need to realize that the higher you go up the ranks, it doesn't mean that you're going to be doing less shitty work, less blood drawing, less drips, less x-ray form. It just means that you are going to be adding to your job description. So you're going to be doing all of those things, as well as seeing patients, as well as running clinics, as well as running outreach. So on the one hand, I know you're frustrated with the work that you feel you're forced to do, but I promise you, you're going to be so grateful one day when you realize it just prepared you to be a really good doctor. I think something that is also coming to the fore more and more now is the mental strain that we as healthcare workers take. Now with COVID, it's obviously been highlighted again. But this is not a new thing, you know, even if everything is hunky-dory in the country and there's not some horrible pandemic going around. It is very difficult to work in healthcare because you see the ugliest of people, you see the ugliest of society, you see how life can be the most unfair. And there is only so much you can do. You know, you can sort out the crash guy and stitch the wounds and whatever, but you cannot change that he comes from a violent environment, or that this woman that was beaten or assaulted has no safe house to go to. You know, there are so many issues beyond the control of the doctor. We are at times just managing the symptoms, that I think it does wear on the strongest person. And I think you couple that with a personality where we all tend to be perfectionists. We want to deliver a certain standard, and you're put in a field where that is not always possible. You are limited by the resources you have and the support you have. And again, I think that all just is the perfect storm. So you need to develop good coping strategies now, because one day you're going to get to a point where a bad exam is not going to be the biggest stressor in your life. And I think a lot of seniors, and I mean our older colleagues, can be very dismissive of these kind of conditions and concerns because they were not in a supportive environment. You just kind of had to suck it up and move on. But I think we're more educated now. We're more equipped to support our colleagues and seek support for ourselves. So again, it is something important to be aware of. And that's why I really like this crazy socks thing, and I support it every year. This is both a good and a bad, because you are going to sacrifice holidays and personal family time, and that's not great. But there is a different spirit when you go to work, because everybody that you're working with is away from family and trying to make the best of it. So yes, it sucks to not be at home, but there is an amazing vibe at the hospital over holidays. Again, Dr. Lowe, he's just got a face for memes. I don't know. This is after he worked a long weekend, and it's exhausting, and the hours are rough, and you know, you still have a whole life going on when you leave the hospital. So that is difficult. You just see some really ugly stuff, like, ugh. This lady was saying to me, they said she needed bilateral amputations. What she actually needed was a good scrub and a pedicure. So yeah, multiple years of training for pedicures. She did keep her legs, by the way. Okay, so the good, because you know, I'm trying to give you an honest opinion, but I wouldn't be doing this job if I didn't love it pathologically. So these are my friends from Internship. This is the parking lot in Kimberley, and again, we are entertaining ourselves. So he is now one of the ICU consultants, and she's a forensic pathologist. But humble beginnings in Kimberley. All right. Dr. Brits and Dr. Hartel, orthopod and a gynae, all friends I met during my ICU rotation. Dr. Mahalik and Dr. Buertes, you all know them well. This is us at a tutorial preparing for our final exams. You can see the craziness has very much set in there. Pediatrics, you find patients in every rotation that you just connect with in a different way. And it's not just the kids, it's the adults as well, and even the trauma schoolies. I mean, they have their own personalities. This was New Year's on the ambulance deck. We were all celebrating, shooting crackers and having a countdown, and it was just a beautiful vibe. This is something that really touched me. This is in our trauma resus. It's a lady that was in an MBA. And the nurses decided that she would feel better if she had her hair washed. And it's not in their scope. They're really just doing it to be nice. So I think as much as we lambast the nurses about how they're rude and, you know, they're horrible to the students and they don't want to help you, they have a very tough gig. I don't think we can ever really understand it, but at Tygerberg, the nurses have always made an excellent impression on me. And I think this is just an example of them going above and beyond, you know, and the nights that they have taught me things and made me a cup of tea because I'm on the edge of a resus. So then, you know, you just realize there's a lot of care in there, and the tough exteriors are also just coping mechanisms. It's actually a shame, it's a horrible story, but I think it's hilarious. And you need to unfortunately find humor in the horrible thing. So the patient in the one bed shot the patient in the other bed, and then they ended up in the same ICU after the police shot the original shooter. So, you know, only in South Africa will this happen. But when we found out, we did move them around, just for the record. But, you know, only in South Africa will you have these anecdotes. This is after a particularly rough corp neck rotation. My students brought me cake and coffee, and it made such a major difference in my day, because, well, actually in my whole rotation, because you try and look after the students and protect them, and you try your best in your work schedule to try and teach them and make sure they get a positive experience out of it, and you don't scare them off the field forever. And it was just really nice that they went out of their way to, you know, that they noticed and that they went out of their way to actually do something for me. You know, it wasn't expected. It was just so appreciated. This was actually one of the very first tutorials I did with the Surgical Society. We did a basic suturing course. And yeah, that's how I got involved with you guys. And I've just clung onto you like a rash ever since, whether you like it or not. Okay.
Can I just jump in? Sorry. I just have to take this opportunity. Thank you so much for everything that you do for us. We really appreciate you.
Oh, it's a pleasure. It's a pleasure. I love you guys so much. Okay, so to be a surgeon, I mean, to be a doctor is pretty tough. To be a surgeon, you need to be especially crazy, because everybody warns you before you go in how tough it's going to be. And I think it's important to go in knowing what you are signing up for. This is often how it goes. We try and not complain too much. I don't think we always do very well, but we try and not complain too much. You are not going to get a lot of sleep, but you do get used to it and develop caffeine habits and so on. Lots to study. I love to buy textbooks. I don't actually use all of them, but it makes me feel better to see them on my shelf. You can see them there behind me. Just seeing them makes me feel like I have the knowledge. Yeah, I love Christina Yang. She's one of my role models. I don't know if you can say a TV character is a role model, but I've often had these things of, should I shower, should I sleep, should I just burn all of my clothes? Keep a sense of humor. I think for me that is mostly what has gotten me through. This is a hernia. I'll give you 3 guesses who drew the face on it. It was me. So you have to keep a sense of humor, but I think very important is to have colleagues that you can talk to and that support you and understand, because as much as your family, your partner, your friends outside of the field love you and want to support you, it's different coming from someone who really understands, you know, who understands that you as a person of 22 has to watch people die or tell people they're going to die. It's just something that is difficult to understand if you haven't been in that situation. I'm not saying develop an alcohol habit, but have social outlets. Get out, get into nature. You know, just really enjoy the simple things in life. This was outside the cafeteria, these little ducks. Oh, so cute. Get into nature, exercise. I've climbed Lion's Head exactly once in my entire reg time, and I'm very proud of that one time. Your religion and your faith, definitely don't lose that, don't negate it, because you are in a scientific field. You know, have various pillars to lean reach out for help. You're not going to get an extra gold star on your certificate at the end of the time because you did all of this on your own. Nobody expects you to. There are your peers that want to support you. There are your registrars that want to be there and support you. There are consultants. There are psychologists. The university really makes so many resources available. And it's not just because they want to look good, but it's because they realize that there are different stressors that students need support for. So please get help, get support, have a cup of coffee, have a chat, just vent with somebody that makes you feel better. Family, this is my family. If anybody wants to know why my surname is Changfoot, it's because my dad is Chinese. So this is my family, my mom and my brother. And they love you regardless. So let them support you as well, even if they may not understand exactly what you're going through. They think you're going to be the best doctor in the world, and it is okay to let them think that. At the end of the day, choose a job that you love. So I think it's important to realize that if during your studies you realize that this is not what you want to do, there is absolutely no shame in getting out, rather than forcing yourself to suffer through something that is going to destroy you. The job is too hard and takes too much from you to do it if it is not something you really, really love. And I'm not talking about an off day. I'm talking about like when you're having an off year. Forcing yourself to do something that you don't have a passion for, you are not doing your patients a favor, and you're going to destroy the rest of your life. So don't do it. And if you do decide to stick with medicine, which of course I seem to have done up until this point, there is so much variety that there will be a little hole somewhere where you will find something that you love. I mean, the world needs dermatologists and pediatricians and physicians and colorectal surgeons and trauma surgeons. So whatever your particular mental pathology, I promise there is a speciality somewhere there for you. And that is what makes the 3 o'clock resusces worth it, and the early ward rounds, and continuously having to study and stay up to date. If it's something you love, it's not quite such hard work. And yeah, that is basically my story in a nutshell. That's again how I have gotten to this point. Okay, Shade, I don't know how much time we have left. I hope you're keeping a timer on it. Is there anything you want to ask or want to overtly fault me for?
No, not at all. Just thank you for sharing your life up to now with us, and the little bits of insight and practical tips as well that we can take from this. I mean, I think a lot of us see this as our future, and it's really nice to have a heads up in a couple of spaces. So specifically on that, I have a question. I think it's quite loaded, but you mentioned and you touched on South Africa and how that's so much different from other countries and what we see. So we have all of the social determinants of health, and we have the political strains, and there's just a lot of other things going on. We are seen as a developed country in Africa, but still not completely on the standard of USA or other first world countries. So in our specific setting where it's resource constrained and we are overworked, how can we still keep that that mental health when, as you mentioned, some of our supervisors were brought up with the idea that there isn't really a work-life balance? How are we practically able to not fight that, but how do we advocate for that, even as students, and being the next generation of surgeons? How can we practically see that becoming our future?
Okay, so there's a couple of points I want to make. Just take me back if I'm getting off topic. So I think one of the first things you need to realize is, to be a good doctor, you need to be a good human. And a human needs to sleep, a human needs to eat, a human needs hugs and sunlight. So I saw a meme once where basically very complicated houseplants. And that is true. So you need to maintain all of those things to be a good doctor. But I have to say that I suppose in this regard, I am a little bit old school. You do not become a doctor like you become an accountant, or you become a marketer, or you become a stockbroker. It is not just a job. It is, I think, a calling. I still believe that. And it is going to expect a little bit more from you than what the average job does. And while you are maintaining a work-life balance, you do need to realize that that may not be 50-50. Balance is maybe not the right word. I don't know what would be the correct word to use. But you are going to have to make do with quality time instead of quantity time, because there are not multiple colleagues to cover the call roster. So while you have to look after yourself, you also have to realize that you are signing up for a very demanding career. I think that the old school doctor that believes that the job is everything is a dying breed, fortunately. And with education, and I think what, the damage that they see being done to people around them and colleagues, and higher suicide rates, there is very much a move towards, looking after yourself and mental health. But if you are an impaired physician, it is better to get out of the field rather than have people cushion you in the job, because then you place extra burden on the colleagues around you. But I think that's a whole different conversation on its own. So you need to look after yourself. But if you get to a point where you feel you are not able to deliver what is required without compromising yourself, then you also need to be brave enough to go to your management, go to your seniors and be like, you know what, I need an out, so that I don't break, because you can need a gap and recover and come back better and faster. So it's important to have insight into yourself and what you need to be a functional doctor, because like I said, you need to be a good human to be a good doctor. Something else I want to just mention, and I don't think we say this enough, is that despite the limited resources and the fact that we maybe are not always on first world standard, South Africa, I actually can't speak for the whole country, but Stellenbosch produces some of the best interns I have come across. I've worked in various hospitals. Like I said, I'm not from Stellenbosch originally, so I'm not too biased. But the standard of doctor that Stellenbosch produces is really something to be proud of. You guys are excellent academically, and with the bonus of actually having good clinical skills. Yes, you can put up drips and get bloods on a stone, which is amazing. But academically, you guys also have a very good background, especially if you utilize all the registrar teaching and all the clinical exposure you guys have. So bear in mind that the option that you guys have to do calls is not because we need the labor. Yes, don't get me wrong, it really, really helps to have you guys on a call, but it is to expose you to clinical scenarios in a protected environment where there is supervision and teaching, because just a few months later, you are going to be the doctor that needs to handle that bowel obstruction, that stab wound. Then you're not going to feel that excited about the fact that you got to leave the call at 8. So bear in mind, everything that is offered to you in the hospital is an opportunity. It's not there to make you feel like slave labor. And there are students from overseas that pay multiple thousands of rands a week to have the opportunity that you guys have. And that said, I had a vascular surgeon rotate with me who had never done blood before. He was a qualified vascular surgeon. And for the first time in his life, he drew bloods in Tygerberg trauma unit. So along with all of those shitty hours and, you know, lists of bloods, everything is making you a better doctor. And when people hear you're from Stellenbosch, they automatically have an expectation of you. And every year that passes through has a role to maintain that standard, because there are generations coming after you and they are going to look up to you and the standard that you as a group set. So yeah, that's just my little lecture that I have to put in there. But so far, so good. Just keep it going, guys.
Thank you so much. I think I have one final question before we can off. So I just want to, I'm sure there's a couple of moments that come to mind, but if you had to think of the most exciting or the most challenging or perhaps just the most unusual situation, patient, case, surgery that you've been in, what comes to mind if I ask a question in that line?
Sure. I have to think now. Well, if I have to go to most exciting, it's probably going to be a trauma case, and it will most likely be one of the front room thoracotomies I've done. You know, it's just it's a primal surgeon thing to cut open someone's chest and hold a beating heart in your hand. You know, there's just I'm not a cardiothoracic surgeon, but it revs my engine. That was really an awesome moment, and especially because the patient survived. So it helps to know you made a difference.
But once again, thank you so much for doing this on the little time that you have off during this hectic season. The Surgical Society really appreciates it, and we just want to send all of our virtual love to you. So thank you.
Awesome. Yeah, no, I hope to be doing more stuff with you guys during this lockdown time, because I think we actually all start to miss the social interaction, weirdly enough. So yeah, looking forward to being more involved with you. Thanks, Shade.
Keep
safe, guys.
Yeah, thank you to all of our members who are watching or have decided to give up their time to also watch. We hope to see you again, so stay safe, and yeah, together we can conquer this.
Okay, awesome.
Thank you.
See you guys. Bye. Let me just stop the recording. How do I do that?
Yay.